Karan, let's finish up by talking about access to pain medications. So if pain medications are indicated, what are some reasons that patients may still not be able to access them?
Yeah, and I think that's a really important topic. Having these resources available versus getting these resources available to you are two different things. So I think some of the most important things that we should consider is the is sort of the cultural factors or the psychosocial factors that we were discussing initially about pain. And it is always good to understand where the patient is coming from, and build that partnership with the patient and come up with the strategy that is best in line with the patient's goal to help with pain medication or help with the pain. And the last but the most important thing I feel is developing that trust with the physician and the patient. And this could be in very simple scenarios. Let's say a patient is calling in for pain medication and the patient has not heard back from their provider for 2 to 3 days. Having a prompt response to patients pain complaints is a duty and is helpful for the provider to understand. The same responsibility falls on the patient as well. If the provider is understanding of the patient's pain conditions and trying to help them, these all kind of things sort of help bridge that gap and increase that trust. So I think these are the most important things, but I know, access does not just mean these two things. And I know this is your area of expertise, so I'm going to punt this off to you. But what about, the cost related factors or, availability of these drugs in the pharmacies? I know you have done a lot of work in that. So can you tell us a little bit more about it?